Welcome back to 3 Talk. Today marks the beginning of Eye Care Awareness Month, and for thousands of South Africans, a lack of information around the matter leaves them blind. Please welcome pediatric ophthalmologist Dr. Damesh Parbu, ORBIS Senior Program Advisor Reshma Davadine. Noleen and her 4-year-old daughter Jasmine was diagnosed with a cataract shortly after birth. Welcome, welcome, welcome. I think ladies first, but the small ladies first. I'm going to welcome that little lady. I don't think she's going to talk to me. Jasmine, someone.
Okay, I'm fine.
Oh, are you fine? Tell me, when did do you remember when you started wearing glasses? Oh, suddenly Jasmine has gone very shy on us. You look very cute, Jasmine. Thank you so much for coming on to 3 Talk. No, she is not bothered at all. Since I started with the young lady, when did you realize something was not okay with Jasmine's eyes?
Jasmine was 6 weeks old at the time when I realized that she had the cataracts.
Where are you going, Jasmine?
She was 6 weeks at the time when I realized that she had the cataracts, yes.
What were you seeing?
I just saw a cloud in her eye, in the inner part of her eye, a little slight cloud, whitish cloud.
Now, how often, Dr. Parbu, how often do you see a cataract in a child as young as 6 weeks old?
When I was chatting with Nombulelo, I was quite amazed that she picked it up at that stage. Jasmine is one of the rare kind of cases that we've operated on at such a young age. And that's the problem that we're facing in South Africa, is that we're picking up children a bit too late. So Jasmine's mum, Nombulelo, was very, very astute in picking up the cataract quite early. And it's often very difficult for parents to pick up on it, and therefore we rely on healthcare workers to pick up on it. But, if a parent notices a white spot in the pupil of a child's eye, it's very important for them to seek care.
Yeah, immediately seek care. And a lot of children, Shama, are going blind in South Africa because of primary health care, or not because of primary health care, but because of not picking up these problems much earlier.
Yeah, I think there's a real lack of awareness. Child eye health is a very invisible issue in South Africa. Yeah. And 50% of it is actually avoidable, preventable and treatable. So I do think that all our programs need to be developed to increase awareness. Yeah. So that parents know what to look for and also know where to go to seek services. And as Dr. Parbu has said, a lot of times I think parents do see, but they think they can wait. Yeah. And the message is that you can't wait, because the earlier they treated, whether it's surgery or other forms of treatment, the better the outcome for good vision. Yeah. And what are some of the more common reasons leading to blindness in children? In South Africa, our leading cause is cataract, both congenital or acquired due to trauma. And that's one of those conditions that is treatable. Yeah. It's a surgical intervention. Yeah. The other one is corneal scarring, caused by vitamin A deficiency, measles, recurrent infections, neonatal infections. Again, conditions that can be treated and avoided. If our vitamin A supplementation is increased, immunizations are taken, this is an avoidable one. Trachoma, which is more due to repeated infections from poor sanitation and face washing, is common in Africa, but thankfully not so in South Africa. It does mean, though, that we need to appreciate the running water, make sure we do have our faces washed, and good sanitation is important. The fourth one is a retinopathy of prematurity, where children that are born prematurely, their retinas can be affected. But again, if our neonatal care can be better than it may be presently, we can reduce this cause as well. And the last one is glaucoma, which is a little bit more complicated. It results from increased pressure in the eye. And those are kind of the 5 leading causes, 4 of which can be prevented or treated early enough.
If it's early enough. And at your pediatric eye care center, doctor, how often are you seeing patients, especially young ones, where they come to you and it's almost too late?
That's the rule rather than the exception. So most of our children do present very late. And that's the point behind this, is to ensure that people are aware and that they are well informed that they should come early for treatment as opposed to waiting until the child is old enough before surgery. Jasmine is a prime example of a child that was operated on at 6 weeks of age, and she's had a very good visual outcome. And that's what we want. For our management, surgery and whatever we do in theatre is part of the improvement that we can provide. But the fact that children come to us sooner provides a huge improvement in their vision at the end. So,
but I think it's what she was saying, that for parents, especially when children are so young, you think, let me just wait. I'm sure it's going to get better, but it doesn't get better. It's going to get worse.
Absolutely, and that's the point that we would like to drive across, is that even healthcare workers must be aware of this, and that they should refer children along. So that we get to see them, we get to operate on them timelessly, so that the visual outcome is so much better at the end.
Tell me more about the work that you do at the Eye Care Center.
I'm a part-time consultant at the pediatric eye unit at Inkosi Albert Tuli. ORBIS has been kind enough 3 years ago to join us in this eye clinic, and they've supported us throughout in providing us equipment and improving the service that we deliver to the community. Because it's pointless having a center with little approach or little reach, and with ORBIS we've managed to increase our reach to the community, so that we have children that are picked out in the periphery of KZN that get fast-tracked into our system, especially children with pediatric cataracts, retinoblastoma, a life-threatening eye tumor, and we get to see them early now, and that is where I feel that that's our major role in the province, is to ensure that we get timeless treatment for our children, and we get good treatment for our children.
I think the lady wants to talk, the little lady, because she's talking to her mum. Do you want to talk to me now? No, she's not going to talk to you. Were you very nervous about the fact that your daughter had to go for an eye operation at 6 weeks?
I mean, I was terrified. I mean, I didn't know what to do. I didn't know what would be, the right thing to do, because this has never happened in my family before. All I knew is that I wanted my child to see. I didn't want to have a blind child, But it was just very scary to go through the whole thing. It was just, a nightmare. But the whole experience with the clinic, with Dr. Parbu, everything was just, they made it so much easier, because everything was just, the nurses are friendly. The whole system, was good for me. It helped me go through all of that. It made it a lot more easier as a mother to go through that.
And she's been wearing glasses, obviously, not since the operation, when she was a little older?
Since she's been wearing spectacles since she was 3 months. 3 months.
3 months?
Yeah, 3 months. She's now 4. So it's been like all her life.
Wow. What advice would you give to mothers, especially when it comes to, once you've done the operation, you need your child to be wearing glasses for whatever time is necessary, or whatever length of time is necessary? What advice would you give the mums and dads?
I think very much like the experience that Nampumere has had, is that don't be scared. I think for all of us it's intimidating and concerning that they're going through anesthetic, but the outcome is very good, and thereafter it's about the follow-up. There is a strong need to have follow-up. So after the surgery, it's not the end of the road. They either need to wear glasses or have follow-up treatment. So those follow-up appointments is as critical as having the surgery done.
Yeah. Dr. Parbu?
I think those follow-up appointments are actually more important than the surgery, because often we end up with a situation where you operate, you restore the pathway of light into the eye by removing the cataract, but then we have a defocused image that falls in the eye, and parents are quite happy to accept that, but that deprives the child of the full visual potential that they can gain. So the follow-up and the regular follow-up and the monitoring is very, very important with pediatric cataract surgery. I feel it's even more important than the surgery, because it's pointless doing surgery if you don't have follow-up.
Yeah. But I think that for mums and dads, there is, I think the message today, there is help available. If, like Nombulelo, you catch it early, there are wonderful doctors around the country. Take your child to the doctor, and there's help available.
Absolutely.
Thank you so much for joining us. Our lines are open for your medical questions on 086 2233 303 or tweet me Noleen3Talk. After the break, we'll be talking about the seemingly harmless little lipids that lodge themselves in our arteries and make mischief: cholesterol.